This is a big cultural difference regarding this point. From my experience, patients will not accept it here, or in Middle East in general, will not accept it to take placebo instead of drug. So I don't know how to solve this point. I don't know, but there is a cultural difference.
You're right. Patients in this region are not too aware of the concept of clinical trials, and they don't understand the difference between a doctor and an investigator. We'll talk more about that in just a few minutes, but a lot of patients believe that the scientist or the investigator is going to act exactly like a doctor. And, you know, doctors don't randomize patients. Doctors are not double-blinded. In fact, how do you tell a patient that your doctor will not even know which group you're going to be in? Whether you're going to be in the placebo group or the active treatment group. And if you tell a patient that, we did a study one time, a focus group interviewed patients, asking them what they think about these concepts of randomizations and the concept of double-blinded, and the patients didn't believe us. They said, there's no way in the world a doctor is not going to know which group I'm going to be in. They also, just like what you said, they said, how could it be that I could be in a placebo group? The doctor should give me the drug that works. So it's very difficult sometimes to explain to patients the concept of a clinical trial, especially if you start telling them the doctor is going to be blinded as well. Now, why do we blind the doctor? Now, you're right, the single blind is for the psychological effects, but why blind the doctor? Avoid, yeah, right. So that the doctor, and his or her excitement about making sure wanting the trial to work, may unconsciously treat the patient better who is getting the drug, or make sure that that patient takes the drug.